Hippocrates once said, "The patient must combat the disease along with the physician." That was true over 2,000 years ago, and it's even truer today. Because in modern healthcare, the fight isn't just about treatment. It's about making sure your voice is actually heard before decisions get made about your health without you. When you stay silent, you're giving up control over your choices that directly affect your life. And while doctors are the experts in medicine, you're the expert in your own body. If you can't clearly share what's going on, important details can get lost, and that can lead to delays, misdiagnosis, or the wrong treatment plan altogether. Now, I'm not a medical professional. What I am sharing comes from my own experiences navigating the healthcare system and from interviews with patient advocates and friends who've been in the trenches, helping people get heard when it matters most. This isn't medical advice. It's about giving you practical communication tools that you can use to work with your healthcare team. Ask the right questions and get the clarity you deserve. In this video, you'll learn a clear, simple way to speak up for yourself in healthcare settings without creating tension, so you can walk away feeling confident that you got the care and information you need. And if you've ever walked out of an appointment thinking, "Oh, I wish I had said that," you're not alone. That exact feeling is a sign of a missed opportunity to speak up, and that's something we can change starting today. Stick with me, because by the end, you'll know exactly how to avoid that feeling next time. Miscommunication in healthcare isn't just frustrating. It can be deadly. The best current estimates I could find suggest that communication failures are linked to thousands of preventable deaths each year just in the US. Part of the problem? Healthcare systems are designed for efficiency. Quick visits, short appointments, not always personalization. And that means if you don't speak up, important details about your health can get lost, and no one will know they were missing. But here's the good news. You can take steps to protect yourself. By learning how to communicate clearly and respectfully, you give yourself the best shot at accurate diagnosis, safer treatment plans, and better overall care. Now, self-advocacy doesn't mean marching into the exam room ready for battle. It's not about being pushy. It's about being clear, confident, and collaborative. So what does it look like when you're doing it right? Here's 6 signs you're advocating for yourself effectively, plus simple ways you can put them into practice starting with your next appointment. You should ask clarifying questions without hesitation. For example, when you ask, "Follow up in 2 weeks?" Do you mean I should make another appointment or wait for you to call me? You voice your symptoms and concerns clearly, even if they seem small. For example, "I know this might not sound serious, but the tingling in my hands happens every morning." You ask about alternatives instead of accepting the first suggestion. For example, "Are there any non-surgical options we should try first?" You request second opinions when necessary. For example, "I appreciate your input, but I'd like to get another perspective before deciding." You bring someone with you to appointments when needed. For example, "This is my sister. She's here to help take notes and make sure I don't miss anything." You understand your patient rights and are willing to use them. For example, "I'd like a copy of my medical records for my files." Of course, knowing what to do is one thing. Actually doing it is another. If you've ever walked out of an appointment wishing you'd said more, chances are that one or more common communication barriers were standing in your way. And here's some more good news. For every one of them, there's a fix you can use at your next appointment. One common roadblock is feeling intimidated by medical professionals. You know that moment when the doctor walks in and suddenly you feel like you shouldn't take up too much of their time? So you end up holding back, even when you have something important to say. Look, I get it. You don't want to feel like you're bothering them, especially if they seem rushed. But here's the truth. Your time in that room is just as important as theirs, and you deserve answers. The problem is, when you hold back, your main concern can go completely unaddressed, and you leave without the clarity you came for. Here's how to overcome this. Before your appointment, jot down 3 things. Your symptoms, for example, headaches, sore throat, trouble sleeping, any medications or supplements you take, and yes, even vitamins and herbal remedies. Your biggest concern? Put it right at the top of the list. Then, as soon as the doctor sits down, lead with it. The most important thing I need to talk about today is That one sentence sets the tone for the whole visit and keeps the focus where it matters. Here's why this is so important. When you walk in with a plan, you walk in with confidence, and confidence makes it much easier to speak up, even if the room feels intimidating. It also shows the doctor you're prepared, which most providers actually appreciate. More importantly, you make sure your top concern gets addressed before the appointment ends. The second barrier is assuming doctors know everything and shouldn't be questioned. A lot of people think if I ask too many questions, they'll assume I don't trust them, or maybe I don't want them to think I'm challenging their expertise. I get it. You want the appointment to go smoothly, not feel tense. But here's some more truth. Good doctors actually want you to ask questions because it helps them give you better care. Here's how to make it easier. Use I statements and be specific. This keeps your questions clear and factual instead of sounding like doubt. Instead of, I don't feel good, try, I've had backaches between my shoulders every afternoon for the past 2 weeks. You can also follow up with clarifiers like, what changes should I make to my routine because of this? This approach turns the conversation into a partnership, not a challenge. Here's why this matters. When you share specific details, your provider gets a clearer picture of what's going on, which means better recommendations for you. It keeps the tone respectful, the conversation productive, and most importantly, it ensures you walk away understanding your health, not guessing about it later. Another big challenge is not knowing the right words to use. Ever sat in the exam room struggling to find the right medical words and then just trailed off? When that happens, the doctor might fill in the blanks for you, and not always correctly. Here's the good news. You don't need to speak like a medical textbook. Instead, try this simple tool. Mirror the conversation back. For example, you might ask, so you're saying I should stop this medication before starting the new one? Did I get that right? This confirms you understood, gives your doctor a chance to correct any misunderstandings, and shows you're listening. Here's why this matters. It takes the pressure off sounding medical and makes sure nothing important gets lost in translation. You leave with a clear, shared understanding, which can make all the difference in your care. One of my pet peeves that might be yours as well is feeling rushed during appointments. You're halfway through your questions when you notice a doctor glancing at the clock, so you speed up, skip a few issues, and leave without covering everything. The problem? Those skipped questions could be the most important ones. One way to prevent this is to bring a second set of ears. Ask a friend or family member to join you so they can help you stick to your list, catch details you might miss, give you the confidence to ask every question you need. And if you're on your own, hand over the top 3 concerns. You know, the ones that you wrote down before the appointment, right at the beginning of the meeting, and say, can we make sure we cover these before we wrap up? This sets priorities from the beginning without feeling like you're holding them hostage. Here's why this really matters so much. It takes the pressure off trying to remember everything in the moment and ensures nothing important slips through the cracks. Then there's the fear of being labeled as being that difficult patient. It's easy to think, oh, if I push too hard, they'll treat me differently next time. But not speaking up can leave you with a plan that doesn't actually work for your life. The fix? Keep it professional and documented. Treat the meeting as if it's a business meeting. Take notes during the visit. Save any instructions they give you and request a visit summary before you leave. If you need to clarify something, use neutral phrasing like, for my notes, could you summarize our plan? Better yet, ask for a printout or an emailed set of instructions. This makes it much easier to do what you're supposed to do later. This also shows you're engaged, not combative, and it keeps the focus on getting things right for your care. Here's why this one matters. Having a written record gives you clarity, proof if anything needs clarification later, and the confidence to advocate for yourself without tension or guesswork. Now that you know how to spot and address the issues that can derail a conversation, it's time to focus on the other half of the equation, how you deliver your message. Even with the best fixes, how you deliver your message can make or break the outcome. The right words can fall flat if your tone, pace, or body language sends a different signal. That's why we're going to look at delivery skills that make sure your message stays clear, confident, and impossible to ignore. And while delivery is critical, it's your emotional intelligence that ties it all together. The final layer to self-advocating in the healthcare system is emotional intelligence. When you approach each barrier with the right strategy, you're not just making your voice heard, you're making sure it's heard clearly and respectfully. That's the shift from feeling powerless to being in control of your own care. But there's one more layer that can make all the difference. And it's not about the questions you ask or the notes you take. It's about the tone, the timing, and the energy you bring into that conversation. And without this, even the best tips can fall flat. That's where emotional intelligence comes in. Self-advocacy isn't just about what you say. It's about how you say it, staying calm, clear, and respectful, even when the pressure's on. And if you start to feel yourself getting upset or frustrated, pause and take a deep, slow breath before you respond. Sometimes that pause is what keeps you from turning a tense situation into a standoff. For example, if you raise your voice and shout out, "This is ridiculous! I've been waiting for weeks! Nobody's doing their job!" Instead, try being calm but firm. "I'm frustrated because I've been waiting for weeks and I'm worried about my health. Can we figure out what's causing the delay and how to move forward?" That second approach still shares the frustration, but it keeps the conversation productive instead of confrontational. Be assertive, not aggressive. The goal is to be clear without creating tension. And remember, empathy goes both ways. Your provider is juggling time pressures too. A little understanding can go a long way in making the conversation productive for both sides. When you bring together clear communication and emotional intelligence, you're not just talking, you're steering the conversation towards better care, better understanding, and better outcomes. Now you're ready to walk into your next appointment prepared to speak up, be heard, and get the answers you deserve. Here's what's now in your self-advocacy toolkit. The why behind self-advocacy, so you can stand your ground with confidence. 6 ways to know you're doing it right and building trust at the same time. 5 simple practical tips you can start using today, plus the most common barriers and how to sidestep them. And emotional intelligence strategies to keep conversations constructive, even in tough moments. When you practice self-advocacy in the healthcare system, you don't have to leave another appointment wishing you'd said more. Share your story in the comments. Your words could be the spark that helps someone else speak up, prevent miscommunication, and get the care they deserve. If you want to keep building these skills, you don't have to stop here. Because if you want more strategies for communicating in high-stakes situations, this is your next step towards becoming your own best advocate in healthcare and in other complex parts of your life. Thanks for watching. I'll see you online soon.